Now, in our fourth and final section of subacute meningitis, we will talk another condition which is syphilitic meningitis. In this, we will talk about the syphilis in general and then what are some causes and signs and symptoms of syphilitic meningitis and how we diagnose and treat syphilitic meningitis. Syphilis is a sexually transmitted disease, is one of STD, sexually transmitted disease, present with painless chancre at the site of inoculation. So at the site where the syphilitic or Treponema pallidum, which is the causative organism of syphilis, where it enters at the site of infection or at the site of inoculation, there is painless chancre formation. Treponema pallidum invade the central nervous system early in course of syphilis. Syphilis is a disease in which we have the primary syphilis, then we have secondary syphilis and tertiary syphilis. There are different phases of the syphilis and how it spread and progressed. And then we have also congenital syphilis also. The babies born with the syphilis, that's the congenital syphilis. So all these are different types of the syphilis. So early in the course of the disease, when the Treponema pallidum invades the body, it can invade the central nervous system and can cause meningitis. So early in the course of syphilis, there is invasion of central nervous system. Frequently involved cranial nerves, and the cranial nerves which are commonly affected by the Treponema pallidum, we have cranial nerve 7 and cranial nerve 8. These are the two cranial nerves 7 and 8 which are commonly affected by the Treponema pallidum. That's the picture of all this rash appear as a result of the infection. Syphilitic meningitis is the complication of untreated syphilis that involves inflammation of the tissues covering the brain and spinal cord. Very, very bad picture of a syphilitic patient with the involvement of the central nervous system. And then it's a complication of untreated syphilis. If syphilis is not properly treated, it can cause inflammation of the tissues covering brain and spinal cord, and that's the picture usually that can be the outcome. Now, the symptoms of syphilitic meningitis, there is vision changes, and we already saw that there is involvement of the cranial nerves also. So there is a involvement of different parenchymal tissues also. So different features are associated with the syphilis. So vision changes are present. Headache, fever, as with any meningitis, fever and headache is present. Changes in the mental status is associated with syphilitic meningitis. Nausea, vomiting, pain and stiffness in the neck and shoulders. Unexplained fatigue, patient is lethargic, no energy. Seizures, sensitivity to light and noise. So all these features are present in syphilitic meningitis. A lot of these are also present in other types of meningitis: fever, headache, nausea, vomiting, neck stiffness. Seizures are present in some type of meningitis. Vision change is present here, and then there is photophobia, sensitivity to light, and there is sensitivity sensitivity to noise. Patients usually don't like the light and the noise. They want to stay in the dark and in the quiet area. So these are some features associated with the syphilitic meningitis, and also there are muscle aches and pains present. Disinterest in eating or drinking is also present. Anyway, patient has nausea and vomiting, and when the patient feel nauseated and they vomit, usually they don't like to eat or drink anything because of the fear of vomiting. Now, diagnosis of syphilitic meningitis, how we can diagnose that it's the syphilitic meningitis. Reactive serum treponemal test. Treponema pallidum is the causative organism of syphilitic meningitis. So we have reactive serum treponemal test, microheme agglutination assay, CSF, FDA, ABS test, not definitive evidence of neurosyphilis. Cerebrospinal fluid, FDA, ABS, which is not definitive evidence of neurosyphilis. Can be falsely positive from blood contamination. Negative CSF, VDRL, not rule out neurosyphilis. Negative CSF, FDA, ABS, or MHATP rules out neurosyphilis. So these are some diagnostic tests which help in the diagnosis of the syphilitic meningitis, but the important thing is if there is negative CSF, FDA, ABS, or MHATP rules out neurosyphilis. So if this test is negative, we should rule out neurosyphilis and we should rule out that it's syphilitic meningitis. So the treatment of the syphilitic meningitis, usually the treatment is aqueous penicillin G. Aqueous penicillin G is very, very effective treatment for the syphilitic meningitis and usually can cause, have associated with good prognosis. Then we have procaine penicillin G, again intramuscularly. It's very, very effective for the syphilis. Oral probenecid also can be tried for the syphilitic meningitis. So syphilis basically is a systemic disorder. It can cause involvement of different parts of the body, different systems of the body, and it can have in different phases. We have primary syphilis, secondary syphilis, tertiary syphilis, and then we have congenital syphilis also, in which the baby is born with the syphilis, and that is associated with so many different abnormalities. But the important thing is, since we are talking about syphilitic meningitis, the central nervous system involvement of by the syphilis is usually present in the primary phase of the syphilis. So in the early phase, the infection can spread to the central nervous system. And then we have different diagnostic tests to find out whether the meningitis is due to the treponema syphilis or due to some other infection. And treponema pallidum, which is the causative organism of the syphilis, the main aim of different diagnostic tests is to find out whether its treponema pallidum is present or not, and then if it's the cerebrospinal fluid negative test of FT fluorescent treponeme ATB and FTS is negative, then we should rule out that it's due to syphilitic meningitis. So, and the treatment is, we have penicillin G, very, very effective, procaine penicillin, and oral probenecid. Then we have again benzathine, penicillin G. So all the treatments is mainly the penicillin, and no other good treatment option is available for the treatment of the syphilitic meningitis. So that concludes our topic of subacute meningitis, and in this lecture we talked in detail about the meningitis caused by Mycobacterium tuberculosis, different fungi that can cause subacute meningitis, like we talked about the C. Neoformans, immitis. Then we talked about cryptococcal meningitis, and in the last section then we talked about the syphilitic meningitis. So that concludes our lecture, subacute meningitis. Thank you for watching sqadia.com.